Okay, so again, good evening, good morning, good afternoon, good evenings, depending on from where you are. I am your host today. My name is Stefan Handoyo. Uh, I'm joining here as your host from Jakarta, Indonesia. And I'm also the host of our WhatsApp community called Marriage, Our Path to Holiness Community. Uh, so far, I'm amazed with the number of interests, the number of participants and members of this community. We have more than 1,000 members, I think from almost 7 or 8 countries. So it's growing every day. I was amazed with the interest, and we hope we can also line up many more experts that will also on lifelong marriage that will also share with us many of their expertise and their thought that can help us also better understanding on this important topic. So today we are very glad to have Dr. Njoki Fernandez. I know Dr. Njoki when I was still working in Nairobi, Kenya. I was with the World Bank Group. I was assigned there. I met her a couple of times with her family when we attended the mass either in Consolata or in the Chapel of Nunciator of the Ambassador of Vatican in Kenya. So it's a perfect reunion again with Dr. Njoki. I'm glad to see you again here. Uh, and thank you very much for your availability today. I think all of us has already had her biodata. Very interesting. I will not read everything, but I just want to point it out that Dr. Njoki is obstetrician and gynecologist. She is also a lecturer on reproductive health, not reproductive rights, reproductive health. She's a medical doctor, and she has a clinic at Consolata Shrine in Nairobi. This is run by the Consolata nuns. So she is also a mother of 5 children residing in Nairobi, Kenya. So today, as you know very well, we have this topic, which is very delicate topics, and many of our probably friends, family members are still asking about, the from the scientific and the moral point of view of this infertility treatments, the in vitro fertilization, IVF, here in Asia, for instance, especially in my country. It's a growing industry. A lot of young couples who have difficulties to bear children, they try to avail the services, but they also have many moral questions. So we hope with this talk today we can shed light on many of these questions that we have, and hopefully we can have clear answer for the Dr. Njoki. So as usual, we will have around 45 to an hour presentation, and then we leave the rest for Q&A. Okay, Dr. Njoki, would you like to start and introduce yourself quickly, and then the floor is yours. Thank you very much.
Thank you once again, Jose Maria, and good morning, good afternoon, good evening to everyone, wherever you are. I hope I'm audible. I hope you can hear me.
Yes, we can hear you loud and clear.
Okay, great, very good. And I hope you can see me. I'm on full screen, so I've put it on full screen so that we are able to follow the presentation. So my name is Dr. Njoki, like you've heard, from Nairobi, Kenya, and the area of fertility has been my area of practice and specialization for many years. And it's something that I particularly enjoy talking about. And yes, so I'm a practicing obstetrician gynecologist. I'm a lecturer in reproductive health. I do marriage preparation for couples preparing for marriage at the Shrine in Consolata where I work. And I also help couples who have infertility challenges navigate and try to see what are the challenges that they have, and and how we can help them. Are they doable, or are they not feasible? Yes, so I live in Nairobi with my family. I'm a mother of actually 9. 5 on here on earth with me, and 4 have preceded us to heaven. So before we start, I'd like to give a few disclaimers. The first disclaimer is that, as Stefan said, this is a very emotive topic, and it provokes a lot of emotion. And so just to make sure that we are respectful when we're having the discussion. People have various opinions, people have various views, various perspectives, and all of them are valid, and all of them need to be respected. The second thing is that I will make a lot of reference to the Catholic Church, because that is the basis for my presentation today, but that does not invalidate those of us who may be professing other faiths. In fact, it tends to unite us because the teachings are generally the same, especially when I try to bring together faith and science. The third disclaimer is that it's difficult to discuss this topic without being explicit. So parental advisory is should be done, especially if you have younger children with you. So I mean, I will say things a bit clearly, and that is the nature of the discussion that we're going to have. I welcome a robust discussion. You can put your questions in the chat, and we can continue along. So the first part of the presentation, we're going to discuss infertility. And the second part, we're going to discuss in vitro fertilization. And I'd like to welcome all of you and thank you for finding the time to join us today. If I lose you at some point, or if I get too technical, or I get carried away, because I might think this is a university class, please just let me know. Okay, so infertility. I hope you can see my screen. I don't know how it looks on your side. Is it a full screen? Is it a half screen? How does it look?
Yes, we can see it.
Okay, very good. So so we've done a bit of introduction, and that is how the presentation will look. What is infertility? What are the causes? How do we treat? And maybe we can come up with a few resolutions and a few conclusions. Yeah. So if we look at human nature, or rather in the animal kingdom, anthropologically, we are created to survive. And we are created to survive and this manifestation of survival is in 3 ways. The first one is we see that animals, and including humans, are geared towards protection. So animals have got claws, I don't know, they have poison, they're able to camouflage, some of them are strong, others are able to do whatever it takes to protect themselves from being captured or conquered by the enemy. And this is the same, I suppose, for human beings. This is one way in which we try to survive. The next way in which we try to survive is the whole area of food. Half our time we are dealing with food. We are eating food, we are cooking food, we are growing food, we are selling food. And even in the animal kingdom, when they're not sleeping, they're hunting and trying to look for food. And then the third thing, which is the topic of our discussion today, is that we have an instinct that has been put into us to procreate, to bring forth the next generation. Because then if we do not procreate, we become extinct as a species.
Dr.
And so
Njoki,
reproduction is...
Dr. Njoki, I'm sorry, can you put on the full screen, the presentation, if you are able?
Like that? You can see that?
Yes, perfect. Thank you.
Okay. All right. So fertility and reproduction is a third way in which we ensure that the human species survives. And this is something that has been put in each of us. It's a natural, a very deep desire for reproduction. And we need to keep this in mind as we're discussing infertility, because it is something that drives all of us to be able to bring forth the next generation. And it's something that we need to understand for those couples who are trying very hard to get a child and they cannot. So what is infertility? Medically speaking, the infertility is the inability to achieve a clinically detectable pregnancy after 12 months of frequent and unprotected marital relations. A clinically detectable pregnancy, meaning that when you do a pregnancy test, it's positive. Yeah. Infertility is not the inability to carry a child to full term. That's something else. But that you're not able to achieve a clinically detectable pregnancy after 12 months of frequent and unprotected marital relations. Frequent is 3 to 4 times a week, 2 to 3 times a week, and of course, unprotected. So if you're in a situation where you live far away from your spouse, you meet every 2 to 3 months, and you're not able to conceive a child, then that cannot be defined as infertility. Okay. Infertility can be primary or secondary. Primary meaning that you have never been fertile, and secondary means you were fertile at some point and something happened and you acquired infertility. According to the local statistics we have in Kenya, it is estimated that 20% of married couples are infertile. And it's important to note that it is not a person who is infertile, it is the couple, it is the relationship that is infertile. And this 20% infertility rate is what has led, I suppose, even globally, to a rapid increase in assisted reproduction. Yeah. So, what are the causes of infertility? Male partner infertility, 30%, female partner infertility, 30%, and a combination of both, 40%. Yeah. So these are the numbers that we have. So in 40% of the cases, it's a combination of the two of them. In 30%, it is the male partner, and in 30%, it is the female partner. But we tend to find that most of the time we tend to assume that it is the female who has issues, but when we can see that sometimes it is the male and sometimes it is a combination of both. I'll try to go into some of the causes of infertility. And at this point, I'll get a bit technical. Please bear with me. I'll try to be as simple as possible. So, female factor and male factor infertility. I'll try and dispose of with the men first because theirs are usually easier to discuss. So we have anatomic disorders, which many of the time are a result of genetic factors. Abnormal spermatogenesis. Spermatogenesis is generation of sperm. If the generation of sperm is abnormal, you will have infertility, and I'll explain that in a bit. Then there's also sexual dysfunction and endocrine disorders. Genetic factors are a big cause of male factor infertility. Okay, maybe I need to go to the next slide and then I can try and explain what happens. Let me start with abnormal spermatogenesis and male infertility. Spermatogenesis is the generation and creation of sperm. The sperm are produced in the testes under the influence of testosterone. There are certain external factors that can affect the production of this sperm. And the first one is temperature. Yeah. And increasing the temperature of the testes can prevent spermatogenesis, and I have explained why. You will notice that in all mammals, the testes hang. Yeah, they are a bit far from the skin to allow at least a 2-degree difference between the body temperature and the temperature in the testes. When it is cold, you notice that the scrotum contracts so to bring the testes closer to the body, so that to maintain this 2-degree differential. So when you have the testes very close to the body, that temperature can prevent spermatogenesis. How does that happen? So people who are long distance truck drivers, and so they sit for long, people who enjoy jacuzzis and hot saunas for long periods of time, and gentlemen who wear tight, very tight underwear. So that increase in the temperature of the testes has been known to affect spermatogenesis. Another very important factor is cryptorchidism, basically meaning failure of the testes to descend from the abdomen into the scrotum. I don't know if you know that the testes are made in the abdomen. And as a result of testosterone in the fetus of the male, the testis descends down the inguinal canal into the scrotum. And that is why sometimes we get what is called an inguinal hernia, because there's a route which the testis comes down from the abdomen into the scrotum. Sometimes that does not happen, or it happens incompletely. So you find that the testes are in the abdomen, or they are halfway through the inguinal canal, or somewhere along the route of descent. A testis that remains throughout life in the abdominal cavity is incapable of forming sperm. So what is a take-home message here? When we ladies who are expecting children go for an anomaly scan, usually which is around 24 weeks, 24, 25, many of them say they don't want to know the sex of the baby. They want it to be a surprise. But I feel any responsible radiologist needs to check and make sure that as you're looking at the heart, is the heart okay? Does it have 4 chambers? Are the valves okay? Are the lungs okay? Are the kidneys okay? They need to check the gender. Because if there's a problem with testicular descent, we want to know early enough so that we can intervene as soon as the baby is born. In fetal life and in the first few months, it is okay, but the testis needs to descend into its place. Otherwise, it will be incapable of forming sperm. Okay. Then, sperm count is another thing. We say that the human reproduction is very wasteful as far as men are concerned. So in every act of coitus, around 3.5 milliliters of semen, and each ml has around 120 million sperm. So you have in every ejaculate up to 400 million sperm. Yeah. And when you have less than 20 million sperm, you are considered infertile. Please note that you only need one sperm to fertilize an ovum, but a count of less than 20 million is considered to be infertile. And there are many reasons why you could be having low sperm count. And maybe this is not the forum for that discussion. But when we assess men and we find that they have low sperm count, and it's very common, for whatever reason, it can affect your fertility. Okay. You can have a normal sperm count, but you're still infertile. That is because the sperm have incorrect morphology. They are shaped wrongly. Or number two, they are not moving. Sperm need to have the correct shape, the head, the body, and the tail. And sperm need to be motile. They need to be able to move so that they ascend up the vaginal canal to the uterus and to the tube to be able to cause fertilization. So sometimes you have a man who has got a normal sperm count, but they are wrong morphology and they are immotile. And I'll show you a picture. Okay, my picture has disappeared. I hope it comes back. There's a picture somewhere which I will show you the various kinds of the sperm. And some have got 2 heads, some have got 2 tails, things like that. And that causes a problem. I don't know where I have lost my sperm. I had it somewhere. It was a nice picture. Okay, I'll find it. I'll find it and I'll share in a minute. Yeah. Okay. Now, let's go back a bit to how the genitalia are formed. In the 7th week, all babies are female. Okay? They all look female. And the embryo has both the male and the female primordial ducts, meaning it is a pluripotent. It can go either way, all right, at around 7 weeks gestation, all right. In the normal female fetus, the Mullerian system develops into the uterine tubes and the uterus. In the normal male fetus, the Wolffian duct system develops the epididymis and the vas deferens. So the external genitalia are similarly bipotential until the 8th week. Now, because of testosterone in the male at around the 8th week, male external and internal genitalia develop. This is important. From around the 8th week, if there is testosterone, which is released by the fetus of the male, then male and female external genitalia develop. If there is no testosterone, that baby remains female. Why is this important? Because sometimes there's a failure. You can have a male boy, but there's a failure of that trigger. So testosterone is not released from around week 8. Yes? So the boy will grow as a girl physically. But because they are XY chromosomally, they are still a boy. Also, sometimes they may have a failure of receptors. Testosterone is released, but there are no receptors. That boy will grow as a girl, but they will be an infertile girl. Now, what happens when this boy is being raised as a girl and becomes an adolescent or a young adult? He will start getting attracted to girls because genetically he is a boy. And then we start calling him gay, but he's actually a boy. So that is why it is so important when you have ambiguous genitalia. You know, when you look at a baby and you're not sure what the gender is, you make sure you get the genetic sex so that you're able to raise that child properly. There could be a failure of the way the systems develop. And that's why I'm going through embryology a bit so that you understand. But we have to make sure that we raise the child in the correct gender. And these children most certainly will be infertile. At around 8 to 9 weeks, if a female child is exposed to testosterone, maybe because the mother has taken some androgens, they will develop male genitalia. Yeah. So that is why it is important around this time to be very careful what medication the lady is taking, because if you take androgens, the child who's a girl can develop male genitalia. I hope we're still together so far. And this is what I'm talking about. Sorry, this is a picture that shows you around the 7th to 8th week in utero. This is the baby in the mother's womb. They look kind of the same. Yeah. The male and the female. And then around the 14th week, because of testosterone, the male on the left, yeah, the slit closes and develops as a male. On the right-hand side, it continues and forms to be female. So if the trigger is not there, you can have a boy developing as a girl. Okay? And if a boy develops as a girl, of course, then they're infertile. Okay? Then the other thing I wanted to talk about before I go to the ladies is we've talked about genetic factors, we've talked about environmental factors. Sometimes men are not able to produce sperm because of their lifestyle, smoking, drinking, some kind of substances and drugs that they take. All right, that is sperm development. Then you can have problems with sperm transport. The sperm and the semen is being produced, but it is not able to reach the outside because of the blockage of the ducts. The duct system, that can be caused by infection, yes, and that can be caused by trauma. If you have radiation, maybe because of you have cancer of the abdomen or cancer of the testis, and your testis is radiated, there will be permanent scarring and blockage. If you have any tumor of the testis, if you have tuberculosis, yeah, sometimes you can have infections that destroy the testis. And the very common one we know is mumps. Mumps is a childhood infection. It's a viral disease. that is not very serious. But if you get mumps or chitis and it affects the testes, the boy can be rendered infertile. That is why we encourage vaccination. Mumps has a vaccine. Yes, you give the boys so that then they are prevent. It's a very transient disease, but it can have lifelong effects. You can also have problems of deposition. The man is producing the sperm, but he's not able to deposit it into the right place. And we are talking about erectile dysfunction, yeah, and priapism and things like that. All right. So these are the problems in the male that could cause infertility. Now, there are people who say that if you go for vasectomy, it's reversible. And I'd like to quell that myth at this point and say a properly done vasectomy is irreversible and causes permanent damage and blockage of the tubes, and it renders you infertile. All right. So to the ladies, there are many causes, and I won't go into all of them because that's another whole day's discussion. There's the way you're born genetically. You can have chromosomal problems that render you infertile. You could have hormonal issues that also render you infertile. And I just want to talk about pelvic factor infertility because it is an acquired form of infertility that is the commonest cause of infertility in our setup. All right. Pelvic factor infertility means that the tubes are blocked. All right. And tubes can be blocked because of endometritis, pelvic inflammatory disease, a ruptured appendix that makes the whole abdomen infected, use of the intrauterine contraceptive device, yeah, increases the risk of pelvic inflammatory disease. Septic abortion, of course, ectopic pregnancy damages the tube, and other pelvic instrumentation. Endometriosis and also endometriosis, I forgot to add, endometriosis causes pelvic factor infertility. And you can see here, these are what we call adhesions. When you have the ovary and the fallopian tube stuck together, and the tube is an unhealthy tube, it's swollen, and this tube cannot allow the passage of the baby for fertilization. Okay, an ectopic pregnancy. This is an ectopic pregnancy that grows in the tube. Of course, this pregnancy is not viable. The tube will rupture, yeah, and damage the tube. If you have pelvic infection, this is what pelvic infection looks like. The tube is blocked on the inside because of sepsis. All right, and this causes infertility. All right, now all these things that I'm talking about, some are treatable depending on the point at which you catch the problem. Some are not treatable. Yeah, I'll give you a story of a lady who came to see me once. She was 30 years old, and she had not received her menses, and she was getting married in 2 months, 2 or 3 months. And she thought, let me go and see the gynecologist because I'm getting married and I've never received my menses. She was 30. And it was sad because obviously she had a genetic problem, which meant that she had never received her menses. And when we examined her, we found that her uterus was the size of a 9-year-old uterus. And she had a blind vagina, and her ovaries were very small. So she had primary infertility, and she was going to get married. So of course we had to discuss, and I had to tell her, and she was Catholic, so I had to tell her, if you go ahead and get married, it will be a nullified marriage because you're not able to consummate your marriage. She couldn't, but she had never checked, she had never known. And that again is a message to our mothers and to our aunties. By the time the girl is getting to the age of 16 and she's not received her first menstrual cycle, you need to bring her, we check and see. Sometimes it is just that the hymen is very tough, and so she's bleeding internally. But that time you have symptoms, she gets monthly pains, or sometimes she actually has another problem. And we are able to at least know what the issues are early enough and raise that child with that awareness. So I'm sure if this lady knew she was infertile, probably her expectations of marriage would have been different. And the end of the story is, of course, the relationship didn't work. When she told her husband, they chose not to get married because they wanted children. And the spouse to be was very clear he wanted children from that relationship. So the marriage could not take place. But I was thinking, if she had known before, you see, that could probably have informed the way she forms her relationships. The other thing is that when you have uh, genetic problems, they manifest in various ways, not just in reproduction, but in other parts of the body, the heart, the liver, the kidneys, the bones. So once you identify the problem, you're able to manage the child holistically and manage their expectations of life as they grow up. Okay. So I know I'm rushing a bit so that we have time for questions. How do we treat infertility? Infertility treatment, number one, is complex because many people present very late. Yeah. Another story, I have so many stories. And a story of another couple who came to see me, and they had been married for 10 years. 10 years and no child. Now the backstory was each of them had been in a previous relationship. Yeah. The man had been in a previous relationship with a lady and they separated because they couldn't get children. But that lady went ahead and married someone else and she got 3 children. This lady, when she was getting married to this gentleman, she already had 1 child. So it was obvious in this relationship who the infertile partner was. But I don't know, men find it very difficult to accept that they have a problem. So it took 10 years for them to finally come and seek medical attention. By which time, whatever it is that was affecting the man, it's almost impossible to reverse. Yeah. So we encourage couples to try as soon as possible after you get married to try and start conceiving, because there are no guarantees that you will get pregnant. And after 1 year, if you're not able to get a chemical pregnancy, then we begin to investigate, and we investigate both couples. It is expensive. Hormonal assessment is expensive, all the imaging, all the labs. It is very painful. Yeah. Physically, of course, because of all the treatments, but also emotionally draining. Yeah. Because when you can imagine that lady who discovered at the age of 30 that she has primary infertility, and she will never be able to conceive, and she will not be able to be a mother as much as she wanted to. Remember, I told you it is an instinct in all of us. She was emotionally broken. Yeah. But maybe if she had grown up knowing, it could have been a bit different. It's very frustrating because you try something and every month you're expecting that you are going to conceive and you're not conceiving. Yeah. It breaks down communication and it can really be a strain on the marriage. And treatment of infertility has no guarantee of success. It is not a guarantee that if you try infertility treatment, it will work. Okay. Now, this is what has made many people decide to go down the route of IVF because of the challenges of treating infertility. And sometimes you find that people are ashamed that they cannot conceive, so they're not open with their treatment, and so they seek inferior medical attention. Two, many of these treatments are not covered by insurance, so they can be very expensive. So some people don't find it a priority at that point. And three, in our society, adoption has not been very well accepted. Many people feel they cannot bring a stranger who they don't know to carry on their family name or to give them their property or to inherit them. So many people struggle with adoption. So what happens in our African society? I don't know about other countries, but in Africa, what happens if the man is considered infertile or they know that he's the infertile one? Usually they get another partner, a brother or an uncle, to raise children for him. And I think it also used to happen in biblical times. Yeah. Um, if a lady is infertile, many men go and get another wife, whether it is an official wife or a second wife, because that man feels he wants to raise children. And that in itself has its moral challenges. But that's how we have been dealing with it until IVF came. And IVF offers, quote unquote, that possibility that the child will be the product of this both the two parents. Yeah. So IVF has come about as a way to try and relieve the pain and suffering that is caused by all these aspects of infertility that we have spoken about. So the take home message here, I suppose, there are many causes of infertility. Some are male, some are female. And the male factor infertility, by the way, is very easy to tell. From the time the child is in the womb to the time the child is born, the male, you can almost tell there's a problem with that child. And as they're growing, you're able to pick up clues that the child could be infertile. And we encourage parents to try as much as possible to do the tests as early as possible so that you're able to raise that child holistically and properly, and they're able to make proper choices in life. I tried to look up canon law. I read somewhere that even to be a priest, there's some impediments to the priesthood as far as male sexuality is concerned. I couldn't get the exact canon. Maybe there's a priest in the group, he can tell us. But even the church prescribes certain things around male sexuality to ordain priests. Yeah, so it's a big thing, and the child needs to be raised knowing what their options are. Okay, so it's been 40 minutes. I don't know if we want to take a brief break before we
Yes,
go
yes, sure,
into
Njoki. Maybe we have
into
halfway
into
through.
IVF.
Yes, so we are halfway. I just want to check if anyone have a question. I do have a question here on the chat uh, from Beatrice Molindwa. So, yeah, do fibroid cause secondary infertility? I know ladies who have had fibroids removed and conceived within a year.
That is true. In fact, I had a patient a few days ago, and she came to me. She was attempting IVF, and she had been told she needed to have her fibroids removed before she could attempt the IVF. And so she came to me to have the fibroids removed, and they were massive. Okay, maybe I don't know if I should show those pictures, but there were many. And the interesting thing is that once we removed the fibroids, the lady was able to conceive naturally. There were many, and they cause mechanical blockage, and they also cause a problem with implantation because they affect the way the endometrial lining and affect the way the baby will implant. So the minute the fibroids were removed, in fact, when I was doing the surgery, I was a bit discouraged because I thought, oh my gosh, this is never going to work. But within 3-4 months, she actually conceived naturally. And then now we were panicking, will the uterus hold the baby, because she had undergone extensive surgery. So that is true that fibroids do cause secondary infertility. And if you have not conceived and you're a bit older, it could actually be a cause of primary infertility. Yes. So another
Thank
question.
you. So I just want also to ask a question here before we move on. I'm not a doctor, so I don't want to ask technical questions, but
No, please
I
carry on.
hope this is the non-scientific questions. You mentioned about when either the women or the man who are about to get married were found infertile, uh, then it can be a cause of, based on the teaching of the Catholic Church, then it can be a cause of nullable marriage. Marriage can be nullified if the infertile persons, either male or female, is not being transparent or whatever. Is it the case? Can you shed more light on that?
Okay. I could be wrong, and maybe someone could correct me, but I know what makes the marriage nullified is if you cannot consummate the marriage. So if you have impotence, if you have erectile dysfunction, or in the case of my patient, she did not have a vaginal canal, so you're not able to consummate the relationship. That one is nullifiable. But infertility per se is not an impediment to marriage. The only thing is that infertility that is known then that is a problem because it affects the consent. Yeah. So, and that is why in my patient, I told her she cannot now get married because she knows she's infertile, and she has to disclose it to the husband. If they both agree to get married, knowing full well that one is infertile and there's a possibility that the fertility cannot be restored, then that's okay. But for the marriage to be valid, you must be able to consummate the marriage. And so that is why we encourage that there's assessment done before, and we are able to fix whatever issues can be fixed before you actually get married, because then that to be a problem. Symph is asking about the church teaching on ectopic pregnancy. So an ectopic pregnancy is a pregnancy that is unviable. I don't know if I can go back to my presentation here. Let me see. I think I had a picture. At least that one, I had a picture here. So you see, we have a baby here that is growing in the tube, right? This pregnancy will not survive. I mean, it's unviable. And so what usually we do is we go and we ligate the tube here. And the baby will not survive, whatever you do. Yeah. So then in that case, we go and we ligate. And if this tube ruptures, then there's a risk of even death to the mother. The baby will die anyway, whatever we do. Yeah. And so in this case, we go and ligate the tube and remove, so that then the mother does not bleed to death. And most of the time, if the pregnancy is small, like this one, there could be small chances of saving the tube, but this one for sure, you just remove, and the patient loses the tube on that side. Yeah, I hope that's clear. Okay, someone is asking, a friend of mine confided in me that they are unable to conceive after their second child. They suspect a vaccination they received after their second birth causing this. And it has been revealed in the link below. Sorry, now I've gone into the link to see what is this. I think, no, I really don't want to go into this discussion of vaccination. I think your friend, this is Kimani, I think your friend needs to find out the cause of their infertility. I doubt it has something to do with whatever vaccination that they had. Yeah. And if you get a good doctor, you will actually get to the bottom of why they're not able to conceive. And this is secondary infertility, right? So I would encourage them to seek proper medical attention. All right. PCOS, what are the causes? Wow. I'm not sure if we'll be able to go into PCOS today. PCOS is something that the person is born with. It's one of these medical conditions of women. And to some, it can cause infertility. It's not that every PCOS patient has infertility. And if it is managed properly, most PCOS patients are able to be managed, and they're able to ovulate, and they're able to have a normal pregnancy. Okay. And as per the church's teaching, what happens if there's a certain unawareness of infertility? If you're unaware, you're unaware. Yeah. And many people go into marriage not knowing that they are infertile, and that's why we are in this space discussing these things. Yeah. But if you are aware, and it can be proven that you knew, that you are aware that you're infertile, and you failed to disclose this to your spouse, that could be a basis for a nullification. In an ectopic pregnancy, what is the church teaching? If the doctors recommend to terminate it, even if it's not viable, I think I've gone through that. An ectopic pregnancy in the tube is not viable. You know, you can have an ectopic pregnancy in the abdomen, and we've had abdominal pregnancies that have been carried to near term, and those babies have survived. Yeah. But in the tube, the baby will terminate. The pregnancy will terminate by the 12th week, whatever you do. Yeah. So we usually just remove that baby. And then someone is saying, I hope every couple got this course during marriage preparation. That's what I do. I talk a lot about these things during marriage preparation so that patients are aware. And they can also examine themselves and think through and think, could I be having a problem such as this one? And how can I get it resolved before we get pregnant? What causes fibroids? The last question before we go into the next section. Fibroids are benign tumors that grow in the endometrium, yeah, in the uterine muscle, and benign tumors that grow in fertile women who are not getting children. And they have some side effects and some have none. And one of them is, of course, infertility. What can be done? Again, it depends on so many factors, yeah. But they're benign and they can be fixed. And we should not be afraid of removing them if you feel they'll affect your fertility. Some people will say, let me get pregnant first and then I remove the fibroids. But sometimes they cannot coexist with a pregnancy, and you have chances of losing that baby if you even conceive. Yeah. Sawa. All right. So let's continue to the next part of our presentation, which is now IVF and why IVF. And I think I talked about this in my introduction. The inability to bear children has plagued humanity since biblical times. I think we all remember the story of Abraham and Sarah. Yeah, God is telling Abraham that you shall be father of a great nation, and Abraham is thinking, how now? I cannot even get a son, you know. And the story of Elizabeth, yeah, in the New Testament, and since biblical times, children have been thought of as a blessing, and when you cannot get a child, it's like God has forgiven you. So they always used to say, God has remembered me, He has opened my womb. It's like those people who are infertile, God has forgotten them. Yeah. Um, and so to overcome this challenge of bearing children, like I told you, it's something that is innate in every human being. And even those who give up getting children, it is a struggle that they have to fight with for the rest of their lives because it is unnatural, quote unquote. Yeah. The natural thing is that we all want to engender the next species, yeah, the next generation. So we have tried to come up with various solutions to try and overcome this challenge. And there's been a lot of work in assisted reproduction, and some countries have even had to do regulation. Yeah. Because what has happened is that people see opportunity and try and commodify whatever it is they're doing. And in the area of assisted reproduction, of course, it is an area that people have found an opportunity, and they know that there is sure money. They will make money out of assisted reproduction. So there are many abuses, yeah, around IVF, and we're going to discuss a few of those, not negating the fact that the people who are looking for a child are just normal people, you and I, yeah. And I have met them. I've looked after women who have conceived through IVF, and I have delivered their babies. And when you engage these patients, these couples, they're just normal human beings who just have a desire to get a child. And some of them go through great lengths. They sell property, they sell land, they travel abroad to try and make this dream come true. So again, there are many abuses and there are many things that we could discuss, but you need to understand why. Why are people going into IVF? To solve that innate problem, that desire for a child. And many of them have tried the conventional medicine and it hasn't worked, or it cannot work. You see, if you do not have a uterus, you do not have a uterus. Yeah, there's nothing we can do about it. Or if you lost your uterus because you had an infection or you are bleeding at childbirth, sometimes it happens that you're bleeding when you're having a baby, and we go in and to save your life, we remove the uterus. That renders you infertile immediately. What happens then if you want another child and that was your first baby, for example, and possibly that baby even died in that experience? Yeah, the lady wants a baby and they want a baby badly, but they don't have a uterus of their own. So what do? They choose to get another way of conceiving. All right. So some of these are acquired, some are inherited, but the bottom line is you cannot get a child even after medical intervention. So they go for IVF. Yeah. So what are the types of IVF? Sorry. So the traditional one, the one we know, is you stimulate the ovaries to produce multiple eggs for retrieval, and these are fertilized in the lab. Yeah. And usually the embryos, they don't fertilize one, they fertilize many because of the chances of one of them, the chances of one being successful are not very high. So you can find that a lady will have 6 or 8 embryos fertilized, and then they implant 2 or 3 per cycle. Okay. There are sometimes, so that is a traditional IVF. They get the sperm from the father and the egg from the mother. Yes. And they have that in the lab. And then after conception, they either freeze them or they and implant some in the lady. Because if she's infertile now, she'll be infertile next time. When she wants another baby, she can come for round 2. That's traditional IVF. Yeah. ICSI, they take a single sperm and directly inject it into an egg to facilitate fertilization. It is another form of IVF, but it's not traditional. It is more interventional. Yes, but it's still done in the lab. In vitro means outside the body, as opposed to in vivo, which is in the body. So all this activity is happening outside the natural state of conjugal love in marriage, which is husband and wife together. It's happening in a lab. All right. Frozen embryo transfer uses frozen embryos from previous cycles. So you have a traditional IVF, and then they keep some embryos frozen, and then now they bring them back and implant them the next time the couple wants a baby. Egg or sperm donor IVF. So sometimes the lady does not have eggs, or the man does not have sperm. Remember, we said that sometimes the testes can be destroyed and the man is azoospermic. Azoospermic means they're not producing sperm, or they have very poor quality sperm. So what happens in this case? The sperm that they have cannot successfully fertilize a baby. So they get a donor. Yeah, a donor. And then that is what now is used to to do the pregnancy. Yeah. And then the last one is gestational carrier IVF or surrogacy, which involves another woman carrying the pregnancy. And the conception can be any of the above combinations. Now, this sounded like a dream a few years ago, but over the last few years, there has been so much advance in assisted reproduction. I went to an IVF conference a few years ago, um, just to see what they were up to, and I was shocked at the advancement in technology and the investment in in all manner of things to facilitate IVF. But like I told you, people invest where they know there's a return. So they know that there's money in IVF. So the investment has been, I wish we invested the same in treatment of cancer or endometriosis or in Alzheimer's disease. We'd get very far. The way there has been advancement in IVF technology. Now, what are the issues around IVF? What are the moral concerns around this whole thing? Number one, like in our country, there's no regulation. So if I want to have a surrogate, I go and speak to a lady and we agree, I'll pay you some money, I'll inseminate you. But what if she runs away? She can disappear forever with my child. I have nothing legally binding me to that person. Yeah. And I remember again another story of a young lady I met once. I was looking after her in the hospital, and this lady was a surrogate. This young lady was a surrogate for another couple, and she had been their house help. She was working for them as a house help in the house, and the lady of the house approached her to be her surrogate. This lady had lost her uterus for whatever reason, and she couldn't get children. So they approached their house help, their nanny, and they agreed to pay her 500,000 shillings, yeah, Kenya shillings to do the IVF, the surrogacy, to be the surrogate. But what these people did is that they implanted not one, but 3 babies in this girl. She was 20, I remember. 3 children. And somehow they all survived. So instead of carrying one baby, she was carrying 3. She was carrying triplets. and which meant that she had to be confined to pregnancy from very early on. It was a very difficult pregnancy. She was so sick. She was vomiting all the time. And of course, with 3 babies, the pressure is tremendous. There was always a risk of miscarriage. So she was confined to pregnancy, to hospital for a long time. And she actually had a husband and 2 other children. So you see, the whole thing of poverty and taking advantage of this girl's situation because she needed money. And to her, 500,000 shillings was a tremendous amount of money. But you see what they did? The 500,000 was for 1 baby. They went and they put 3. So this lady was confined to the pregnancy, and that's how I was looking after her in the hospital. Now, what happened? At the point of delivery, the lady refused to surrender the birth notifications because usually they're put in the name of the mother, and the hospital knows the mother is the surrogate. Why? Because people told her, your deal was for 500,000, but you have carried 3 children, so they need to give you 1.5 million. Yeah. So it became a twist in the con game. So now this lady has to look for 1.5 million shillings to give this surrogate, which was not in the deal. But you see, she had also tried to con her. I mean, you get the problem. Yeah. There's a lot of funny things happening in this whole thing of trying. So we've commodified babies and we're using to trade with them. That is already a problem. Yeah. That we find in these things. So what does the church say? The church says many things. Yeah, the Catholic Church has taught a lot around IVF and assisted reproduction. And I'm just going to narrow on one document, which is called Donum Vitae. Yeah, it is an instruction on respect for human life in its origin and on the dignity of procreation. It was issued on February 22nd, 1987 by the Congregation for the Doctrine of the Faith. And the secretary, like the one in charge of this congregation at that time, was Cardinal Ratzinger, who ended up becoming Pope Benedict. Yeah. And I'll quote some parts of Donum Vitae. Yeah. It says in section 2b6 that if the technical means facilitates the conjugal act or helps it reach its natural objectives, it can be morally acceptable. If, on the other hand, the procedures were to replace the conjugal act, it is morally illicit. Yeah. So moral artificial assisted reproduction assist nature achieve conception, whereas immoral acts replace the conjugal act. I think this is clear. Anything that replaces the conjugal act is illicit. So you can be given fertility drugs, yes, drugs to help you ovulate, drugs to help you improve your sperm count, drugs to help with erectile dysfunction, yes, all those things. But for as long as they're facilitating the natural conjugal act. It also continues to state that 5 criteria must be met for artificial reproduction to be morally licit. The first one, all ART procedures should only be performed on married couples. So we are saying that if you're going to assist a couple reproduce, you cannot, it has to be on the married couple itself. So this business of getting reproductive material from a third party, yeah, it contributes to what is called technical infidelity, because you have introduced a third party into the marriage, into the relationship. That's what the men of old used to do in traditional African society. If I cannot get children, I bring my brother to get children for me. That is still a technical infidelity. So you must, the reproductive material, the ovary and the sperm must be from the spouses themselves, whatever it is that you're going to do. Then Donum Vitae also says that masturbation must not be required. Fertilization has to take place in the woman's body. So this knocks off all these IVF procedures that we've talked about, because all of them are done externally, not in the woman's body. And then the spare embryos cannot be discarded or frozen or experimented upon, and selective abortion should not be conducted. So what usually happens? There are patients, okay, there are patients who know that they're going to get irradiated. Their testes are going to be destroyed. There are patients who know they're going to get chemotherapy because they have cancer of the breast or cancer of the ovaries or whatever it is, and they're going to lose their reproductive function. So they freeze embryos in the hope that once they recover from their illness, then they're able to use that material and continue with their life and get children, etc. So what happens when the couple disagree? When the couple divorce, for example, or separate? What happens when the sick party dies? There's a doctor. I don't know if you guys have heard of her. She's on TikTok. She's a very famous doctor on TikTok. She's called Dr. Kim. She passed away recently. She had sarcoma, and she was giving a lot of information about her life on TikTok. One of the things she told us is that they had frozen embryos with her husband because they were newly married and they hadn't gotten children yet. Yeah. So, and then towards the end, when it was obvious she was going to die, someone asked her, "What is going to happen to your babies?" And then she says, "My husband can do whatever he wants with them. Yeah, because I'll be dead." So what if the husband decides he doesn't want those children? What if he gets another woman who he can get natural children with? What will happen to those embryos? They'll be discarded. Yeah. But they're babies. They're already alive. Yeah. Because you cannot freeze them forever. Freezing is very expensive. Sometimes what they do, they donate them to science. You can imagine the horrors of experimenting with living human beings. The first IVF baby was born in 1978. Yeah. So 46 years ago. You can imagine the amount of experimentation and trial and error that went before that 1978 conception, and that has gone on since. So many babies are being used for science, and that is wrong. You cannot use living human beings to 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 experiment on. Yeah, the church has a problem. The church has a problem with. So you cannot discard them. You cannot freeze them. There was a major suit I was reading about the other day. A couple had frozen embryos and they divorced. And so the lady was saying the embryos should be thrown away because she doesn't want the man to raise the children. The man is saying they're my children, I'll raise them with another woman. You see the mess? It's a total disaster. Then the other thing that is a problem now is the whole thing of same-sex marriages. If two men come together and they want a child, what happens? They have to get a surrogate, isn't it? Because, I mean, they have no capacity to get children their own. Or two ladies, yes, but they still have to get a donor for their sperm. But the two men have to get a surrogate. And it's happening, and it's happening a lot. Yeah. And all these situations are also because of the fluidity of the marriage situation that we're having now. Two men are living together, two ladies are living together, and we have the whole transgender. So I was born a lady, I want to become a man, and then I get married to a man. All this confusion is causing major concerns in the area of artificial reproduction because they still want children and they feel that their life is not complete without kids. So the Catechism of the Catholic Church 2378 states that children are the supreme gifts of marriage. Children are a gift, not a commodity, not something to trade with. It's easy for me to say this because I have children, but children are not a right. Yeah. We cannot say that we will get kids no matter what the cost or no matter what it takes. Yeah. Children are a gift from God, and gifts are given to those he pleases. So he gives to some and to others he doesn't. Yeah. And this is very difficult, especially for couples who do not have children. But this is it, that the children are a gift. Yeah. I think I've talked about this. The fate of frozen embryos, they're discarded, they're donated to research, and they're donated to infertile couples. But those are your children being given to someone who you don't know, and you will never know how they will raise your children. So it's a bit unfortunate. Yeah. And this is what happens. Yeah. So children are a gift. Children are gifts from God. Now, what are the outcomes of IVF? Death. There's a lot of death of embryos. They die by the millions. They die because it's experimental. And so they die naturally in the process of fertilization and trying to play around with them. They are also selected because now, because of technology, couples are able to choose the kind of babies they want. They're able to say, I want a baby with blue eyes and with blonde hair, and I want a baby with certain features. They're able to pick out babies with genetic disorders. So if a child has Down syndrome or all these other chromosomal disorders, they're just removed. They're selectively aborted. Yeah. Babies that are not required so there's a lot of death of our babies in the IVF industry. The other thing, multiple births. Like that case I've given you of my patient who wanted one baby but ended up having three. Some people think that multiple births are desirable. Not always. Not always. Yeah. And there is always a higher risk of many complications for the babies and for the mothers. Yeah, multiple births are an error of nature. It's not how it is intended, especially for human beings. Yeah. So it is an extra strain and it has its challenges. Number three, genetic defects. Because of the way the IVF is done and the chemicals that are used and the way the freezing is done, studies are showing that more and more children born of IVF are having some certain genetic effects that would not have survived if they were conceived naturally. You know, Charles Darwin's law of natural selection. You find that many babies die. They are aborted naturally. You know, in fact, for every 100 conceptions, only 25 will be born. Yeah. The rest drop off along the way. And it's a way of nature selecting the species. There's nothing we can do about that. But because of IVF, you find that many of these children are able to dodge that natural selection and they are born with genetic defects. And of course, the biggest one is the financial costs. You find this cycle doesn't work, they try again and they keep trying. It's like gambling, you know? And families have been known to be destitute because of IVF. Yeah. So what to do? What to do? What do we do? The first thing is that we look after our fertility. You know, it's something that we cannot take for granted. And we treasure your fertility, you respect it, and you conserve it. We look after fertility and that one of our children from a very early age. Yeah. Look out for problems so that we're able to fix them very, very early. Yeah. That is what you can do to prevent having problems. Yeah. Treasure your fertility. There are ladies who they say, I'm done with having children, so they go and have their tubes tied. Uh, it's true, you could be done, and I agree with you, maybe, or men go and say they want to have a vasectomy, but your fertility is such a gift, and you might not know when you might need it again, yeah? So we look after our fertility, we treasure it, we respect fertility. We don't play around with what God has given us in terms of fertility. Number two, we seek help early. Yeah, seek help early for problems that you think you could be facing in your marriage or in the marriage of your loved ones. Let's look at our children critically. Look at them head to toe. From the time they're in their mother's womb and you're going for all those ultrasounds, begin to look at them properly so that if there are issues, we're able to pick them out early and we're able then to raise the child with a proper mindset. Yeah. And number three, if you're struggling in this situation, to remember that children are a gift. And for me, I think infertility is also a gift. God has looked at you in a special way, in a special love, by giving you that gift of infertility. It sounds ironical, yeah, but it can be a gift and it can be used also for His glory and everything. And I think I need to stop there. I've spoken too much. And
Wonderful.
maybe we can have a few questions.
Thank you. Wonderful. A lot of
I
information
know there are
here.
many.
Yes, a lot of information, a lot of lessons we absorb from you, Dr. Njoki. Excellent presentation. We have probably around 15-20 minutes for Q&A. Before I ask my own question,
Yes.
probably I want to check participant here. Or maybe we can
So,
question in the chat first, Dr. Njoki.
there is a rise in female infertility, secondary causes. Wait. What are the preventable factors? And you mentioned infection, others, diet, etc. So yes, secondary means that you are fertile and something happened. Yeah. And the one that I talked about, I chose to talk about because it affects the most is a pelvic factor infertility. Pelvic factor infertility, mainly infections, and I talked about them. Uterine fibroids, hormonal factors. We're talking about secondary, meaning you are once fertile and something happened along the way. Diet, I'm not too sure. Sometimes, of course, drugs, yeah, treatment. If you are unwell, if you get cancer or one of these treatments that require you to get radiation or chemotherapy, that could affect your fertility. Tuberculosis of the pelvis is very dangerous to the pelvis and causes all these problems. So what we do is that we encourage you. If you've been trying for 1 year and you've been doing it properly, please seek medical advice and come for medical attention with an open mind, knowing that it can be anything. Don't start concluding for yourself that it was that drug I took or it was that vaccine I was given. No. Please come, because you might actually find it something so simple that we're able to fix, and you can go along your way. What is the Catholic Church's teaching on IVF? I think I've gone through that. Yeah. I think I've gone through that extensively. Is it okay to take oral medication to overstimulate follicles and then conceive naturally? Yes and no. With guidance, I said that it is correct to the doctor can give you medication if we assume that you're not ovulating, yeah, to allow you to then stimulate the follicles and then conceive naturally. I think I have a problem with your wording, overstimulate. Overstimulate is wrong, because when you overstimulate, what do you have? You get multiple pregnancies. And we don't want multiple pregnancies, because then that causes problems. So sometimes your follicles need a bit of stimulation, yes, and that one can be done. Is it true that children born from IVF are unable to reproduce naturally when they become adults? No. Many of those children are normal and healthy and go and have normal families. Remember that children conceived from IVF they're not at fault. It's not their fault. Yeah. So many of them are normal. A few will have genetic concerns, but they can have normal life. There is undescended testes treatable, especially when realized later when the child is around 13 years of age. 13 is late. 13 is late. Remember, we said that the adolescence in boys begins from around the age of 11, 12. And that is when now the testes begin to produce the testosterone and the hormones for the secondary sexual characteristics. So the testis has been in the abdomen of this child for 13 years. That is late. It is unlikely to be reversed. Yeah. So that is where we are saying from the time the baby is born, if you did not do it before, check. You can always feel the testes. You can know if they're there. And when the child goes to the pediatrician or to the clinic, ask them to check. Sometimes you can feel the testes in the groin. You just feel a lump and you know it's on its way down. Then we can fix it. Yeah. So 13 is late. 13 is late, and we hope we never find a child with undescended testes at the age of 13, because we will have failed that child as parents. Yeah. Does contraception lead to infertility? Yes and no. It depends. Again, that's a very broad topic. Maybe we can discuss contraception another day, so that I don't say something that will put me in trouble. Yeah, we can have a separate session on, and then I'll dive into contraception and infertility. Right, yes. Yeah, because I'll get into trouble. You mentioned that fertility could also be God's gift. How can you help elaborate? It's the same way, I suppose, that we see illness as a gift from God. You know, some people who have chronic conditions, you have chronic pain, or you a certain disability that you're not able to function normally, you can still use that to give glory to God, and you can still sanctify that so-called painful situation that you're going through. And in the same way, infertility being as painful as it is and considered a condition that you're struggling with, can also be a gift from God. It can also bring you closer to Him and help you serve Him in other ways, especially by the gift of adoption. I believe those people who adopt children will have a very high heaven, because it requires a very special grace for you to take a child that was not yours, you don't know where they came from, you don't know their family, and raise them up as your own and give them your heritage and your name and your property and your love. That is a gift. And maybe God is giving you that opportunity to look beyond the normal to other things. So I always tell my infertile couples that, it is a gift from God. And if you see it as such, then you don't struggle. You don't struggle so much. Yeah. Ada is saying, do I have a book? I think before I die, maybe I'll publish one. Thank you. Yeah, we could think about that. Is there cutting edge medical advances to aid primary infertility? Can the same be applied to secondary infertility? Primary infertility, it depends. It really depends on what the cause is. Some primary infertility is irreversible. Yeah. Remember, I spoke about if you have a boy who does not have testosterone receptors, so they're raised as a girl, that is irreversible because they were born like that. Or you have some people who have got an extra X chromosome or an extra Y chromosome, or those are irreversible things. Yeah, and there's nothing you can do about that. Yeah. Secondary infertility, there's a lot of technology, but I said you have to be able to go the long haul, and you have to present early. You see, if you come after 10 years of waiting, then chances are that it is a problem. But if you present early, we are able to try and see what can be done. Yeah. Primary infertility, many of the time we try and help the person live with their life and live the best way they can in light of the circumstances that they have. And they can be normal human beings and they can have a very fulfilling life. Yeah. But they need to know. I spoke of children who are genetically male and then born as female, and then female and then born as male, and then they are attracted to the people of the same sex. Yes. What is the church's teaching on this? Okay. Well, all right. So now, if a boy is a genetic male, XY, but because of whatever issues they are manifesting as female, they are genetic males. So when they become attracted to girls, it's not wrong per se because they are male. And so it's a natural thing. Yeah. And that is why we are saying, please get these children identified by their genetic sex as early as possible so that you assign the correct gender to these children. You can imagine, um, a boy who is raised as a girl, and then he goes to boarding school with all these women, and he's a boy. We'll have a problem, isn't it? But we have let him down because we raised him wrongly. So let us try as much as possible to assign correct gender to these children. Yes, so that we don't accuse everyone of being gay when actually they are not. And we've seen a lot of this happening. Okay. Are there negative consequences of a child born of a mother after 55 years? Yes and no. Again, 55 is old. And I'll just make one statement. Remember, and I suppose Maria Wandai, you're talking about a natural conception. Remember that the woman's eggs, the ovaries, are the same. She has the same number from birth to menopause. So from 20 weeks in utero, the same number of eggs you have the same eggs until your natural menopause. So at the age of 55, if you conceive, your eggs are 55 years old. Considering the way we live our lives, I don't think those eggs are genetically sound. I mean, they have been beaten up a lot by life, yeah? The drugs, the hormones, the life you've lived. And you find that many of these children who are born of older mothers have been known to have certain genetic challenges. Not all, many. Yeah. So it can happen and you can be okay. As opposed to men get a new batch of sperm every 72 days. So them, they are ready to go all the time. But we, whatever eggs we have them for life. So a 55-year-old lady has 55-year-old eggs, and those are old. And that could affect the quality of the baby that is conceived and born. Could you check is a typo in my email address? Yes, it's .com. Sorry. Ooh, I'm so sorry. It's .com, not COOM. It's .com. Does age, like being over 40, lead to secondary infertility? Yes. For some people, as you grow older, it is more difficult to conceive, especially as you're approaching menopause. Yeah. I think I've gone through all the questions, unless anyone has something else to add.
Anyone want to ask questions either through chat or directly? But that I have a couple of questions on Njoki if while waiting for others
Yes.
to probably post their questions. Is that you mentioned that about the commoditizing, baby right now through all this natural, reproductive treatments. And Pope Benedict, the former the late Pope Benedict, is very clear in Donum Vitae that anything outside of the married, and it's considered morally illicit, right? So so how do we approach this when we have our friends or family members probably not the same faith as what we have? What is in your experience? How do we approach this so that they also understand that the beginning of life, the sanctity of life, without going through this documents?
It's a difficult conversation. It's difficult because you realize many of the times people are looking for a child precisely because of societal pressure. A couple is married. The first year, there's no baby. The second year, there's no baby. The third year, there is no baby. Then they begin to tell the man, go and look for someone else, go and look for another woman, because this one clearly is not getting um is not getting a baby. Yeah. So societal pressure. So if we were to ease a bit on pressurizing couples to get children, because you don't know their journey, you don't know their struggle. If we were to remove that pressure, that would already help. And then that way, then they're able to come out and talk about their challenges and their struggles, and we can be able to see, where are they, and we can help them. And then again, that acceptance that not every marriage relationship will be fertile. Yeah. And that is a reality. That is what it is. So if you're blessed to be part of that 20% that are infertile, then what do we do? But they also need to be encouraged so they don't spend every coin, and it's family telling you, yeah, we'll pay you for your ticket, we will pay for you to go to the ends of the earth to see if you can get a baby. It's not necessary. So a lot of formation, especially in marriage preparation classes, I insist, when you're going for marriage preparation, those of us who are involved in marriage preparation, we need to be able to 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 explain to couples that it is true you're getting married, but it is likely that you might never get children. And so they get into marriage with that frame of mind. And it's not an entire shock when it actually happens that you don't get the
Okay.
children that you had wanted. Yeah.
I have a follow-up question also, Njoki. Sorry. So the church is very clear that the beginning of life is when the egg is being fertilized by the sperms, and I think scientifically also that's the case, right? And therefore, and also that has to be in the context of valid marriage. In our faith is inside the sacrament of marriage, the conjugal act between the married couples, right? So anything beyond that is morally illicit, and that if it is morally illicit, therefore it is a sin. Anything that the way of conceiving is not done in a natural way and doing the unnatural reproductive treatment. Is that correct, the way this way of thought?
Yes, that is true. And someone, I think, in the question is asking, about insemination. Insemination has issues. Yeah, insemination would mean that the sperm is taken out of the man somehow, usually by masturbation, yeah, and then put into the woman, yeah, by a syringe or by a cannula or something like that. So that in itself is not it's not in the natural conjugal act.
Yeah.
It's out of the conjugal act. So it's a bit dicey. And so it's still not out of the woods yet. It's a form of artificial reproduction. It is not IVF, but insemination, someone is asking, I wouldn't say it is okay 100%. It still has certain challenges. Yeah. Uh, do I do IVF on patients who need it, or do I refer them? No, I don't practice IVF. But I look after patients who have had IVF and they come as normal pregnant women, and we look after them and we deliver them. Yeah, but I don't practice IVF personally. Yeah. Could I talk a bit about how especially the Catholic keeps asking couples where the babies are and talk highly of those with 10 kids? Such can be insensitive, especially painful if you're trying to get babies and it's not working. And that is very true. And that is why I have said in one of my comments, we need to ease the pressure on couples who are struggling. We need to stop. Every time we meet a married couple, you're asking them, so where is the baby? Where is baby number two? Why is there no baby? It's none of our business. And it really makes them feel bad, especially when they're genuinely trying and they're struggling with infertility. So it is true that we need to stop giving them pressure, and we need to be very sensitive to couples who can't. And let's assume that they are really trying and they are doing whatever is necessary, and we pray for them, and we just stay out of that conversation, because we are the ones who are giving them pressure to go and even try things like IVF. Yeah. um I think I want to see if I went through all these questions. Could I reiterate on what I said earlier, whether contraceptions lead to infertility? I didn't comment. I said to be continued.
Yeah.
I beg we have another session,
Yes.
so that I don't give an incomplete answer to. It's a very broad topic, and yeah, I don't think I have enough time to do justice. Yeah. I mentioned that IVF increases the risk of abnormalities in children that would have been naturally terminated uh, in natural pregnancy. I'm curious to see same increase of risk for people on fertility medication. That yes, people on fertility medication usually can have multiple pregnancies. It's one of the side effects of. But you see, this is a natural conception. Fertility medication just enhance your natural fertility. So you could ovulate more than once. You ovulate more than one egg, and then you can have a multiple pregnancy. But this is not something that has been imposed from outside. It is your body naturally. So then that's okay. The problem is the conditions under which the IVF is being done in the lab, and the chemicals and the preservatives, they also cause genetic mutations. Yeah, because it's artificial. It's not how the body is used to doing its thing. And those mutations are the ones that cause now genetic problems in genetic problems in the babies that are born. It's 1:27. Stefan, over to
Yes.
you.
All right. So
I,
wonderful.
I don't I don't think this
Thank you so much.
conversation. Okay. Last question.
Do we have
What
question?
leads to
Okay. Yeah.
giving birth via CS? Is it true that to such there's a limit on the number of births she can have? Okay, now. And with this, I finish the discussion. Cesarean section is an intervention to try and deliver the baby safely. And if your doctor decides that you need a cesarean section, and hoping that it's a genuine decision, then it's okay. Yeah. Uh, sometimes women try and avoid cesarean section to the point where then they themselves get into trouble and lose their baby. Yes. Sorry, my son is wondering where I went. Yeah. So cesarean section, if the doctor is genuine, it's okay. Just let's save this baby now and save yourself now. Sometimes you think I wanted 8 children, but because of cesarean, I'll only get 3. I mean, who knows that you are going to get 8? We don't know. Yeah. So sometimes we fear cesarean sections, we panic, and we get into such a twist, which is not a good thing. If the doctor is genuine and the clinical condition is genuine, you can proceed with your cesarean section. Out of my 5 pregnancies, my last one was delivered by cesarean section after all the rest had been normal deliveries. So you can imagine my situation. I really needed to, but it was okay because it was necessary and needed to happen, and it's okay. It's fine. Yeah.
Thank you.
I need to end there.
I remember one time in our marriage life that we wanted to have a second baby, and then we went to the OB here in my country, and the OB-GYN suggested us immediately to do IVF. So we were just kept silent. We just kept silent, and then the following week we did not go back to this doctor because we know that this is something not correct. So yeah, we have to be careful. Couple has to be mindful, and I think your talk provide a lot of information for us in terms of the scientific aspect of fertility and as well as the moral aspect of the IVF and fertility treatment. I think I can summarize 2 important things here. Is that one is that children is a gift of God. No? So it is not something that we have to fabricate. We have to commoditizing this baby because of we want. So we have to be clear on this. And then second thing is that for those couples who are unfortunate enough not to be able to have children because of the infertility, then as you said, that can also be a blessing from God, right? So that it is something that though we are suffering, that it is something that we can always bring it into for the glory of God in any other ways, even without children. I saw many friends of ours of mine who have no children, but they are doing well, and they do great things in their life, and they are very happy couples. So with that, I'd like to thank you again, Dr. Njoki, for this wonderful morning, your time, afternoon, your time, being with us. For many of us who probably will not be able to join, I will try to post it in the group, and I'll try also to post it in YouTube so that you can also, see against and follow against the presentation of Dr. Njoki. If you have any questions, feel free to email Dr. Njoki in Nairobi directly. I love to, probably if I in Nairobi I bump into you, I'll ask many questions again. But then lastly, I also would like to give you a heads up that our topic for next month, last month we have been in Europe with Ciro Candia, and then today we go to Africa with Dr. Njoki Fernandez. So next month we hope to go back again to Asia. We'll have a couple from Singapore who will talk also something related to the topic that we talk about today, which is the gift of life. So stay tuned, everyone. And thank you very much for joining me and Dr. Njoki this today. And very a good morning, good afternoon, and good night to everyone. Thank you.
Thank you.
Bye-bye.
Thank you.
Thank you, Dr. Njoki. Yes. Have a wonderful Sunday.
Happy Father's Day.